I grew up in a small country town. I went back there as a GP for many years. I was there when the family was young. My wife worked in the Aboriginal legal service there, and it's fun being in a small town. It's fun being able to practice that medicine. And the big thing for me now is to translate what I used to do in individual medicine into helping other people to provide care for the people of rural New South Wales.
What brings you here today?
I've got an earache, so
I suppose one of the main things is that there is a shortage of primary care doctors, of family physicians, general practitioners, whatever you like to call them, all over the world. And that applies in Australia and in rural Australia, in rural New South Wales just as much. There's a great opportunity for doctors from the UK to be able to experience not only the medical culture of Australia but the social. It's similar, but there are rewards in the sorts of things that you'll be able to do as a doctor, the sorts of things you'll be able to do professionally. And there's enough fun in it that, and you make enough money that you can go off and do some of the other things that people might be interested in doing in Australia, whether it's diving on the Barrier Reef or seeing the desert or seeing the top end. So through Practice New South Wales, we're trying to give UK doctors the sort of knowledge from UK doctors who've come to New South Wales of what it's like, how you can do it, and that it's fun. We can do that with Australian trained doctors because they have experience in general practice through their undergraduate time. But so through Practice New South Wales, we're trying to give the video clips, the website information, so that doctors who are in the UK can see that it's a real experience and it's a good thing to do.
we'd like to really make sure that these placements work. We're happy to help in any way possible to make sure that the doctors are happy and contented in their new practice, as well as their families in the town that they're going into.
The network is a network, but we're not just a narrow focus on getting bums on seats, on getting people into positions. So we do lots of things around conferences, around locum provision, and then we have to look at the whole primary healthcare scene. So we do research into how best to get doctors into rural areas, how best to get doctors into general practice these days. We provide a lot of IT support. One of the things that we're looking at doing now and we'll be doing over the next year is providing financial management support for doctors so they can get on with the business of being doctors while someone else takes care of the small business side of a general practice.
Sure whether you're after the contract?
We have a really close relationship with a number of the stakeholders in the process. We work closely with people at the Medical Registration Board, within the Department of Immigration, and also at Medicare. They're the folk who will be issuing your provider numbers. We're constantly on the phone, emailing, faxing to all of those people, so we can be your point of contact to those folk.
We're looking much more now at people spending some time in a rural area. They don't have to be there forever. We're looking at a continuity of medicine rather than a continuity of doctor. Basically, we try and find ways to look after people at the same time without, we're not an administrative organisation for general practice, so we're not interfering with people's clinical or professional life. They get on and do that, and we try and look after the things that get in the way.
I guess really what we're here to do is to help rural New South Wales in gaining the best quality doctor that they can that suits the community.
And to support the doctor to identify a practice, move in, start working and feel as though they're part of the community and they're happy with the choice that they've made to come to New South Wales and work as a rural GP.
This makes me want to go.
So while it'll be good for us to have some good doctors from the UK working in rural New South Wales towns and helping to improve the health of people in rural New South Wales, it'll be good for those UK doctors to have a different set of experiences, both professional in the way that general practice is probably a little bit less constrained in New South Wales than it is in the UK these days. personally, and that there are all sorts of different things to do, both in the medicine, which can be quite holistic, and through to the personal, with the opportunity to relate different ways to communities, but also to go off and do things on their own.